run soon. I do first, before we begin, want to especially thank the American Academy of Family Physicians Foundation for the funding that they have so generously provided to help us bring this group together, and a lot of the resources that you're going to hear about as we go through the afternoon. We have a representative from AAFP-Foundation with us today. This is Sandra Goodman, and so please be sure to tell her thank you as we get started. A couple of things I just want to point out. You have a very nice packet put together with some of those resources, and please just look through that and feel free to take that with you. Dr. Homan also provided some things that I think she'll probably tell you about that are in the bags. With no further ado, I'd like to introduce our moderator for today, Dr. Bob Moser. This is one of our premier stellar family doctors in the state of Kansas. For those of you that might not know, Dr. Bob, he was Secretary of the Kansas Department of Health and Environment for 4 years, and is now working at the Heart and Stroke Collaborative at KU Hospital, and also putting together an ACO of, I don't know, 50-some counties, providers in 50-some counties across the state. So, Dr. Bob, we're very privileged to have you here to moderate our session. Thank you so much.
Thank you, Carolyn. Well, certainly do want to welcome all of you here today for this panel discussion on the Highlight on Vaccination for Teens program. So, just to kind of get started, a little bit of an idea of the program that you'll be hearing today. As you know, despite the CDC recommendations on the vaccination recommendations for teens, we still have a high percentage of teens that remain unvaccinated. And so we know that when teens and their parents or guardians come to our offices, that many times they're there perhaps for other reasons and focused on that. The practice is busy, and so sometimes being able to focus on the vaccinations that are due and to get those implemented can be a challenge. So the goal of the vaccines program today is really to kind of highlight where we are with the vaccination rates with our teens, but also to understand that how critical that is to protect our teens from serious infectious diseases by making sure that they are up to date on their vaccinations. But to achieve this, one of the other goals of this program is really to help the providers by giving them tools to improve their vaccination coverage among their teen patients. Now today we're also going to review the 2017 Childhood and Adolescent Immunization Schedule, which now features a specific 16-year-old platform visit that's recommended to particularly focus on keeping the teen patient up to date on vaccinations. As Carolyn mentioned, there's a variety of tools and materials for you and your staff to use with your patients, parents, and guardians that are also available on the Highlight on Vaccinations for Teen page on the AAFP-Foundation website. We'll be reviewing those materials today, a little bit later on, but I suspect some of you may already be familiar with those. These materials will be made available to the 15 states, including Kansas, that are part of the Highlight on Vaccinations for Teen, and they're having similar panel discussions in these other states as well along the same lines. And I'd like to walk you through our agenda for this afternoon. You will first be hearing from Dr. Gretchen Homan, a pediatrician and an immunization champion who will be discussing our current immunization rates and risk of under-vaccinations. Then next from Shari Sutton, she'll talk about the incredible work that's taking place in Salina and developing programs to improve the immunization rates and to help protect against these devastating infectious diseases. And then we'll hear from Dr. John Eplee, a family physician who also happens to be a member of our Kansas House of Representatives. He's been very involved with the immunization issues over the years and is the past president of Immunize Kansas Coalition. And then finally, Bob Werner will talk about the day his life changed forever and the incredible effect of vaccine-preventable diseases can have on the family and his family in particular. And then we'll conclude today with an opportunity for questions and answers. And you can ask any of this panelists a question. And we can also take the opportunity to talk about how it has impacted your practice or your family, any particular special situations that have come up. So without further ado, I'd like to turn it over to Dr. Gretchen Homan.
Hello, thank you for having me. Can you hear me okay? Okay. So I'm going to jump right in here, and this is the vaccine schedule. This is from the CDC. You can find it online, and I don't recommend that you memorize it because it is a little bit complicated, and they do update it. So it is, it's kind of one of those documents that you just want to reference. So I've highlighted in those dark bars toward the right side of the graph there, the teenage years. So the first one is that 11 to 12 year age range, where we are recommending 4 routine vaccines. So the Tdap, the meningococcal vaccine, influenza, if it's that time of year, which it is now, and HPV. And then at age 16, that's that second bar there, and that's when you are recommended to get the second dose of the meningococcal vaccine. Now there's a range of ages. So in fact, HPV is approved down to age 9 and safe and effective, and can be given age 9 or 10. But 11 is kind of the standard starting age. So those are the targets that we've highlighted there for you guys. So why is vaccinating so important? This is one of my passions. I love prevention. I mean, if I could always have my child in a helmet, fully vaccinated with the seatbelt on and a toothbrush in their hand, I mean, there'd be no trouble, right? So if I do a good job, nothing ever happens, and I don't get that big, glorious recognition, but that's great. I love boring. I work in the clinic. I don't want to have to call for help. I like it boring. So, right. Looking at influenza specifically, it's the 8th leading cause of death in the United States for adults. I thought that was amazing. I work in pediatrics, and I tell my patients that the flu kills more healthy kids than sick kids, previously sick kids, which is true because there are more healthy children. But this is a big deal, and it's completely preventable. Between 2004 and 2012, flu complications killed 830 children just in the United States, previously healthy. It's estimated there are 80 deaths per year in the United States from meningococcal disease. And as far as cervical cancer in the United States, over 4,000 deaths per year from that. And then the cancer deaths that are growing and becoming more prevalent, unfortunately, this is the oropharyngeal cancer in men, and we estimate now over 13,000 new cases of HPV-associated oropharyngeal cancers are being diagnosed every year in the United States. We have a vaccine for cancer. It's pretty incredible. So how are we doing in Kansas? Where do we stand compared to the rest of the country? That first line there, for 1 dose of Tdap, we are in 31st rank compared to the country. So that was in 2016. So you can see the change there from 15 to 16. And we now have data that combines for the HPV, both boys and girls together. So that's very interesting. And we now have a category for HPV up to date, because depending on the age at which the child gets the first vaccine and is able to complete the series, there is either a 2-dose series or a 3-dose series. So if they are able to get that HPV vaccine before age 15, they can complete the series with a 2-dose. If they're getting it after that, it's going to be a 3-dose. So we can measure vaccine complete rates. But we have a ways to go. Specifically, if you look at HPV, we are ranked 37th and 45th. I started, and I did pass out an orange bag for you guys, and I put a notepad and a pen in there and a little card. When I started this work a couple of years ago, our state of Kansas was ranked 50th out of 50. So we've made some improvements, but we definitely have a ways to go. Ooh. And this is data on the influenza vaccine for our state compared nationally, and this takes us directly to the CDC website. I don't know if we can open that. This is a really cool interactive map the CDC provides, and you guys can log in and check on it at any time. So you can specifically click on your state and see how we are coming in comparatively. I don't know if you guys referenced this during the flu season, but it's interesting because they keep track of disease burden as well, so it's a really nice reference. Patients are also often interested in that data. So if you click, I don't know if you can click on Kansas, or did you already do that? Yeah, so if you see, there we are, that red bar as far as coverage compared to all the other states. So we are in the lower quadrant. Thank you. So what can we do to do a better job vaccinating for our adolescents and preteens? There are so many strategies. So I want you to pick and choose the ones that fit best and try multiple if that's the right thing to do for your patient or for your office. Some things that are proven effective. The goal of having no missed opportunity to vaccinate, I think, is huge. And this was a cultural shift that we made in our clinic a few years ago to give anything to do, and it almost always is safe to do that. So key step in doing that is assessing vaccine status for every patient every time they come into the office. Because if you don't know that they're due for something. So I recommend using, we use the WebIZ, so state registry. It's very excellent. And you run a report on patients and you know who is missing a vaccine, who is due for a vaccine. If they're coming in for a sick visit or acute visit, you can take care of the vaccines right then and there. So no missed opportunity. Consider vaccinating, like I said previously, for HPV at age 9 and 10. And I've talked to a lot of pediatric offices around the country actually who have started doing this, and for a couple of reasons. They like the idea of doing the HPV vaccine at the younger age. In fact, they feel that it actually even further removes any idea of a sexually transmitted disease because they're giving it at an even younger age. And they like the schedule of it. So they can do 1 dose HPV at age 9, 2nd dose age 10, then they do Tdap and meningococcal at age 11. So that's just an option that you have in the schedule, and it may work nicely for patients. We need you to strongly recommend the vaccines. It's a really big deal, and it needs to come from you, the provider, and from the staff, the nursing staff, the front office, the folks who take the phone calls and schedule patients. Everyone should be on board and be comfortable with the pro-vaccination culture. So please provide education for the entire office, answer any questions that anybody may have, and make sure they're comfortable doing this so that they use the phrasing that while you're here today, if you're due for any vaccines, we will offer those to you, and just kind of be in that frame of mind for every visit, every time. And don't ignore it, bring it up, because if you don't bring it up, it's still on their mind, the parent's mind, the patient's mind. In fact, some kids, that's all they think about no matter when they come to the doctor. Am I getting a shot? It's in their mind for sure. So go ahead and bring it up, and they might have questions, and that's fine. Talk to them about it. If they do have questions, that often is a sign that they just need more reassurance from you, the person they trust with their medical advice. So just open up the floor for those questions and answer them just directly and simply. There are things you can do in the office to help facilitate vaccination. It is a time investment. If you can set up so that the nursing staff can do vaccinations without having the doctor involved, that is very successful. In fact, I do a lot of quality improvement work, and one of the phrases they throw around all the time is, anytime we can remove the doctor from the situation, things run much more smoothly. So if you can empower the nursing staff to work off of standing orders, they can vaccinate, and some offices do this where they vaccinate the child before the doctor even comes in. And for this teen group, it is recommended to have a brief waiting period of about 15 minutes after vaccines, regardless of which vaccine you're giving, just because they can have a vasovagal response and are at risk for syncope. So if you decide to run your office in which you give the vaccine before the provider comes in, then they're done with that waiting period, and the visit may even run more smoothly because they're not stressed or thinking about the vaccines. they can focus on the other issues that they want to talk to you guys about. So that's an option too. We like to use reminder and recall systems and definitely utilize that decision support that's built in with WebIZ, so it'll tell you when the next dose is due, and then you can go ahead and plan and schedule visits that way. Any provider prompts in the EMR are also helpful. And then check your numbers. This was an eye-opening experience for me in our office as well, because I feel like, well, we're doing a good job, we're doing fine. Well, run your numbers and find out, because if you don't know where you can make improvements. So ask those questions of your office, what are my rates for Tdap? What are my HPV rates? And then check them twice or 3 times a year and then see if you're making progress. So.
That was great information. Thank you very much. So, I am Shari Sutton. I am the immunization lead nurse at the Smoky Hill Family Medicine Residency Program. Our medical clinic is Salina Family Healthcare. On a side note, I'll have to admit, when I first started this job, I did not want to do an immunization nurse position. But I always wanted to work in a doctor's office, so it was my foot in the door. 8 years later, here I am in front of you, talking about the successful program that I am proud to lead. So a little about our clinic. About 9 months before I started, we'd gone through some training to kind of revamp our immunization program. That was 2007. 2009, happy to say, we were the recipient of the American Academy of Family Physicians Immunization Most Improved Award. 2 years later, a Best Practices Award. So, and I kind of brag, our clinic immunization rates beat most national rates. It's easy to do the program when you find out the value and care about what you're doing. So there's lots of options on getting immunizations. You can go to Dillon's while you're picking up milk and get your flu shot. You can go to your health department. Lots of options. Pharmacies can do a lot of vaccines for certain populations and insurances, but why not do them at your medical home? Having the complete records there, that way you don't have to guess, oh, did you get your tetanus shot, Not to mention, it improves your immunization rates fabulously. But as adolescents without the right insurance may not be able to go to CVS and get their teenage immunizations. The 1994 Federal Vaccines for Children program was developed to provide state-funded vaccines for uninsured, underinsured patients. Thanks to that program, it has decreased referrals to health departments, improved continuity of care, and increased immunization rates from birth to 18, something fierce. So the importance of vaccines for teens, let this sink in. One of the greatest medical advancements is immunizations. The only thing that it has been topped by is clean drinking water. I heard that information at one of the Kansas immunization conferences, and it really floored me to realize that. So our old system, this was when it was at well visits only. Doctors handled all the review of the vaccination tables. They had to address what was due. And now you think about it. Doctors get, maybe 20 minutes to see their patient. Some of these kids, especially healthy adolescents, they're not going to come in except for their annual school sport physical, right? So there's a lot of things. Mom will come in with a laundry list of things. Physician may not have time to think, oh gosh, that's right. You're due for your meningitis or your HPV or your tetanus today. So we changed it up and we did a training. The training I referred to originally was the MOBI training. That's what we did in 2007. It's maximizing office-based immunizations. They taught us the true indications, better schedules, how to use catch-up schedules, so that you could get your kids up to date the most effective way possible. They also helped with teaching holding techniques for those children and teenagers that are flailing around because they don't want to get that shot. And I gotta think, a lot of people think 4-year-olds might be the hardest ones to give immunizations to. You haven't been around a lot of teenage boys. And then they definitely recommended taking advantage of every visit possible. They're coming in for a stub toe. Let's get their shots taken care of. We also use Kansas WebIZ, as Dr. Homan was mentioning. This is helpful so you can see shots that your patients have maybe got at other clinics, but of course, oh shoot, new patient visit, mom forgets to bring the shot record. Well, hopefully WebIZ has that information. There's been a lot of benefits with school nurses are putting in their history, so we're really starting to see a more complete immunization record out there to help catch the kids that are due and then not accidentally revaccinate kids that have already been done but don't have the records for. What our clinic uses is the ACIP recommendations. This is develop written recommendations for routine administration of vaccines to all of our patient populations. Includes vaccination schedules, those minimum intervals, so we can catch them up faster, contraindications, and these statements are official federal recommendations. So think back 20 years. A lot has changed in immunizations in children. Back then, 6 vaccine series were completed by a kid by the age of 18. Today, it's 14 vaccine series. You know, and each one is announced and released and recommended. Some nurses are thinking, oh gosh, now we've got to do another one. You know, it's like, my patients are going to be so mad because I swear I told them 2 years ago they were done. But nursing staff, we're true patient advocates. So we really got to think, awesome. Look at the more protection we can provide, you know? So enough fluff. How do we do what we do? Our program basically consisted of designating a key immunization nurse. Only duties that were done. At that time, it was me. I was the only nurse that did immunizations for the whole clinic. Thankfully, our immunization program's grown so much that we now have 2 immunization nurses on staff. But we designate a key immunization position. And if you can't do that focused position, then somebody that can just take the lead. They're the ones that'll help identify your barriers, missed opportunities, catch up schedule, and happen overnight. But you pick 1 or 2 things to improve on those barriers you identify, and eventually you see improvement. Every quarter, when you run your numbers, you get excited. It's like, oh yeah, I'm up more from last quarter. We keep up on vaccine recommendation changes. We help train coworkers on the reason and the how-to of the program, and then that person implements the process. We also utilize our vaccine reps. They can help you so much with the new recommendations, changes in the recommendations, changes in dosing, things like that. Know as much as you can about the diseases we're protecting from. One of the biggest things that has made me love my job is, well, a few years back I was at the Kansas Immunization Conference, and one of my vaccine reps was telling me about a dinner after that evening session, and so it was on meningitis, meningococcal vaccination. So I went there and I was able to meet this woman, Abby Wolf. Oh, man, it was so powerful. And we're going to hear from Bob today. Oh, it is these stories that fuel my fire. They are the ones that, I left this conference, and on my drive home, I decided, oh, new motto, I'm going to immunize the world one Delta at a time. Or at least my community, okay? So stories like hers will help you prevent those missed opportunities, okay? So next 3 slides, she was mentioning, take it out of the doctor's hands. We developed a standing order. Doctors have enough to worry about. So we developed a standing order. Basically, we follow what the ACIP recommends. So just a copy of what our order is. And then we review it every year. You also don't want to make assumptions. Give the patients and parents the right to make their own decisions. This is a little graph that shows parents' perception of the importance of each of these vaccines, and then the light blue bar is what the physicians thought that the value of recommending that to their patients. They thought, oh, they probably won't want that. Gosh, just another shot is just going to make them cry. Okay, look at that though. Majority of your parents want to protect their children in every way they can. So it's our job to make sure our patients understand the facts. One thing, okay, 73% of the public knows that HPV is cervical cancer or can lead to cervical cancer, but 25 to 30%, only 25 to 30% know that it can lead to head and neck cancers. 42 thought HPV was the same as HIV. 25% got information from their physicians. Only a quarter of the people talked to it with their doctors. And then only 19% knew that the vaccine was available for both males and females. So how do we handle parents' concerns? It's all in the presentation. We like to talk to our patients on their level. They're teenagers. I'm not going to sit and tell them about all the medical aspects of it. We don't go in and say, hey, we want to protect your 11-year-old from cervical cancer so she doesn't get genital warts. You know, no parent's going to think that, oh, we need to get that today. So we'll say it's not necessary at this time. Present the vaccine that it can protect against HPV. It's becoming one of the leading causes of head and neck cancers, passed only through deep kissing. That is something, I don't say that the vaccine is going to definitely prevent that. I only state the fact that it is becoming one of the leading causes of head and neck cancers. To me, I would instantly give it to my kid, which I did. We do reinforce the fact that when given at age 11 or 12, that the protection is stronger than if the child waits until they're ready at 14, 15, 16. Not to mention, if you want to just limit the shots, get it early. It's only 2. You wait till you're 15, you're going to get 3. Then you think about, I have one patient who's, oh, she doesn't need it. She's saving herself for marriage. That's great. That is fabulous. However, that doesn't mean that whoever she marries and whoever that person was ever with may not have made the same good decisions as what she was doing. You got to protect them, you know, so that even their good decisions may not be the best. Meningococcal hesitations. I didn't bring my books. I like to point out how easily it's passed. Sharing a water bottle, how it's tested for, how fast it can progress. You know, if you're not in the hospital like that, you're going to be having major risks, if not life and death. So, and then I point out, well, the way we tested is a lumbar puncture. I promise my needle is smaller, you know. So making the most of the vaccines, it always helps when you have your nursing staff and your physicians knowing to recommend the vaccines. Reinforce the recommendations with an enthusiastic approach. I tell my kids I poke with love. I'm going to make it as gentle as I can so that they don't hurt. I buy the little pain-free spray to make them think it's going to be that much better, you know. And some people it works, some people not as much. And we do it at every appointment. We even have immunization-only appointments. So when they come and get their first HPV or meningococcal vaccine, say, hey, reschedule in 1 month or in 6 months so that we can come and finish your vaccine series. You just got to make an appointment with me. We give all recommended vaccines the ACIP recommends, not just what's for school. You know, here's your little school recommendations, and then over here's the young kids, they can maybe get the Hep A, and then our adolescents, recommended HPV, meningococcal, and influenza. So do you only recommend that your patients don't get those diseases? I know my paycheck is not signed by the school board, my check's signed by my clinic. So our program, these are our immunization rates. I am very proud of those. So, oh, I skipped one. One thing that we do is with every day session, we print off the provider schedule for the previous session. We go through, we look up every child in WebIZ to see what they're due for that day. We then print out on the doctor's schedule, okay, this kid needs their Tdap today, or second HPV. Then we have the WebIZ sheets, paper clipped the vaccine information sheets. When those medical assistants come in to check them in, here's what you are due for today. Not, hey, can we poke you with these today? You know, it's on how you present. Then physician goes in and sees them. I like the idea of doing it before the visits, though. I might have to utilize that one. But we do the visit, we come in, hey, it's time for shots. We try to make it as happy as possible, and they're done. That's what brings us to those immunization rates. Now, like I said, it's taken 8 years to get them to that point. But being an immunization nurse, unfortunately, is a thankless job. Kids you poke today that you make cry today are never gonna call you and say, hey, you know what? If it wasn't for that shot you gave me back when I was 16, I would have caught meningitis today, and I may have died. They're never gonna get that. You're never gonna get that thank you call. So for that, I just wanna say that I thank you for all the work you do with immunizations.
Thank you, Bob, and I want a special thank you to Carolyn for giving me this opportunity. I think it's a great subject today we can talk about. I want to thank the foundation for supporting this. This is great. This is what our foundation should be doing, and I'll have to double my donation, I guess. So, before I jump into my slides, Carolyn's already braced me for the fact that I'm not going to get through my slides, and I notice I've got 5 extra minutes. So, you know, I don't know. We'll see how it goes, but I'll try to move it along, and I probably will go through the slides very fast because I want to get to the advocacy piece at the end, and because it's something I'm currently pretty excited about. So I come at this as a little more senior than some of our panelists here today, and my champion involvement for immunizations really started in 1986 when I was a frustrated family doc practicing in Atchison, where I continue to practice. And I was frustrated in that I saw a lot of competition, was my perspective at that time, with the public health department and our inability to get together on communicating on vaccinations and who gives what vaccines and how that all works. And frankly, I think they felt competition, we felt competition, and we just couldn't get together, at least in our county. And I learned this was kind of a pervasive problem throughout the state. And it was at the same time that then Governor Joan Finney formed a task force called the Immunization Task Force to look at our low immunization pediatric rates in the state. I met with this organization, and they brought in shareholders and stakeholders from all over the state that were involved with public health, KDHE officials, nurses, mid-levels, LPNs, RNs. It was a really very good group. And out of that, we learned that we're all guilty of being territorial. And I had a light bulb moment. I mean, I really came around to understand that, our pride is part of the problem. And once we all kind of got around that, I had a 180-degree change on that. And then we embraced how we can all become collaborative shareholders and trying to improve rates. And we made a dramatic improvement in pediatric rates at that time, skyrocketing within 5 years up to the threshold of near 90% with all our basic pediatric vaccinations. And we embarked on a computer system that didn't work so well for about 10 years, but was the pre-system. It was KISS or KLS that evolved eventually into WebIZ, which is a very robust tool and managed by KDHE in the state. So I've stayed in touch and been involved with that. And part of that then has been my presidency of the Kansas Medical Society, and I outlined when I was president in 2015 or 2014 that I wanted to make immunizations a centerpiece of my presidency in the Medical Society. And ironically, ICC was transitioning to IKC, launching a new organization in our state, Immunize Kansas Coalition. And it was like, well, if you want to walk the talk, dude, you should step to the plate and be the chairman. And so I got to be the first chairman of IKC as we reconfigured ourselves and relaunched ourselves in the state in 2015. Right. Again, I'm going to go through these pretty fast. I'm pretty proud of IKC, where we've started and where we are right now. I get 0 credit. Some of you shareholders are in the room, so you can wave your hand if you want to when I get to that part. As far as an overview, we're going to talk about the history of IKC, what our current goals are, and they basically dovetail in nicely with today's talk, as you'll see, about our policy teams, and again, we'll go through that. Again, IKK started in Immunize Kansas Kids in 2005. Its mission was really focused on children, and we wanted to take a bigger picture, so we evolved into a new term and a new logo and became proprietary with IKC. And this was, again, collaborative work of the group that met then. And there was, I can remember the first meeting in Wichita in Sedgwick County Public Health, and there was probably 20 of us there, and we kind of just had a session to find out where we should go, and we really realized that we need to make this a broad coalition, and to do that, we need to protect all Kansans from vaccine-preventable diseases. And again, I got to be the first chairman, flip through that picture pretty fast, but this is our current leadership. Our current chair is Laura Conley. Immediate past is Hope Crable, who did a fabulous job of taking us up to the next level, and then happened to be in the presence of greatness today with our chair-elect, with Dr. Homan, who's here with us today. But different hairstyle, so just point that out. Again, when we first founded and formed, we had 15 founding member organizations. Over the course of the last 2.5 years, we've grown to an organization of about 43 members. We used to have about 20 to 25 folks show up, and now we're probably getting 40 to 50 folks show up. We have a lot of people that tie in to our coalition through the telephone lines, so we'll probably have a pretty significant presence. We like to think we have a wide array of shareholders that involve physicians, nurses, public health officials, KDHE, mid-levels, and certainly school nurses. And I'm sure I've left out some other shareholders, but some of them are outlined there. Provider associations, and also I don't want to leave out some of our vaccine producers. They're very involved also. We have appropriate categories, and we just recently went from our bylaws to a 501(c)(3). I think that process is just recently completed. It's almost completed, and it's again a work in progress, and it's helping us go to the next level where we can write grants and become more self-funding and stand on our own 2 feet. And I just can't go without recognizing Phil and helping us, Phil Grimm in our audience today, for his work on this. It's been invaluable. Again, our current focus is of the Immunize Kansas Coalition is on improving access to and rates of adolescent immunizations, paying special attention to HPV and meningococcal vaccination rates. So again, that's what we're all about today. So IKC really dovetails in nicely with what we're talking about today. We have 4 strategic teams. They are policy, education and awareness, funding and grant development, and improved systems performance. Again, at that original meeting, we evolved into these 4 working groups. And because there's so many members, everyone kind of, migrates to the group they think they can help the most with. And we've gotten in the habit now at IKC of meeting of having the policy group meeting, the strategic team meetings before we go into the big meeting where we all sit down together. And then when we sit down together, we outline what each working group is working on, what they're doing, and we'll go through that now. So the policy team currently is reviewing and considering impacts of policy issues in Kansas and in other states. And as a legislator, I certainly engage and interact quite a bit with them. One thing that, we'll talk more about this maybe at the end, but Missouri, for example, did revise a statute that allowed them to make the meningococcal vaccine a required vaccine in their state. And that was a good thing. It caused their rates to go up dramatically over a very short period of time. We've looked at that, and again, if we have time at the end, we'll talk about that. And then Kansas House bill, for example, we talked about 2646, which evolved into a bill I'll talk about at the end, authorizing pharmacist vaccination, and it was a broad look at trying to increase pharmacist engagement with vaccines in adolescents under age 18, which heretofore was not legal in the state of Kansas, except for flu shots. And this was to take it down to age 6 at the time. That was the proposal. And then we also looked at a model school exclusion policy. I call this the Deborah Eplee policy. This was something she was in my ear about because she was so frustrated with the different exclusion policies of our different school districts because they're all over the map. And we have a model policy that we've tried to share with USDs. And I think this is an opportunity going forward to do a better job. I'd love to see the state embrace, and this may be, again, a legislative opportunity to come up with a uniform standard for school exclusion because it's not good the way it's being done currently. Finally, college and university model vaccine policy. This is the meningitis policy as outlined here, and it's to improve the coverage of Kansas college university students' coverage. So, education awareness is to promote the goals and messages through any way they can, and the things that we've really evolved through rapidly in the last 2 years, and I don't know if I have any members on that team here, but are our toolkits, and they're very robust, and I hope we have a chance to demonstrate those today. We also, through the education awareness team, we participate in many workshops and conferences, just like this today, but also the Kansas Immunization Conference, where I've spoken a few times, the Kansas Academy of Family Physicians Conference, the School Nurse Conference, KAAFP, annual fall meeting, gotta get my glasses adjusted, and the CAMU annual conference. So those are just a few of the meetings that we do interface with. And you can see some of our members are here today, and they serve at booths at these meetings and try to raise awareness of what IKC is about and what we're trying to accomplish. Again, this is our website, and it shows some of the things that we offer through the website, some of the tabs you can click on, where you can find recent news updates on our Facebook page, and yes, we do have a Facebook page. And again, I don't think, well, Connie's not here today, but Connie Satzler has been just a tremendous resource for us. She's based out of Manhattan, and she and her team have helped us evolve through a website, through our Facebook presence, and it's been fantastic. You can find us on Facebook and our website and have all kinds of resources. And it's, frankly, it's made us bona fide, and that's very good in the state of Kansas for all folks that are involved with immunizations. Funding and grant development, we have an awards program. I served on that group. We looked at this as far as how we were going to do this, whether we're going to offer grants or we're going to have just awards. We finally settled on awards because we thought it would be much simpler, direct, and that worked out pretty well. And the first round was a recognition grant. It was, I thought, a great success. The second round of awards, which is ongoing now, we just started. We just have our ability to raise money, to get grants, and to sustain ourselves going forward. you know, I hate to say that we operate on a shoestring budget, but we operate on a pretty slim margin budget for as large an organization as we've become. And my hope and goal and dream is that we can broaden our resource base through other grants and other opportunities going forward. I'll say this through KDHE and their granting ability, we've been able to sustain ourselves very nicely, but I think we have challenges into the future, and this is something that this team needs to really work on as we do become, again, a 501(c)(3). Again, from the first round, we had 14 groups total, 3 health departments, 4 medical residencies, 7 providers and clinics. You can see here that we had different strategies: 2 HPV, 1 dose, 9 3-dose series. We had 9 participants. We had 3 participants for 1 dose meningococcal. We had 4 winners, and they were kind of spread throughout the state, which is kind of nice. These are some of our recipients last year when we gave these out. I'm sorry, actually 2 years ago. But we hope to be standing before you maybe with new award winners by, I think, January of 2019 is when we'll get it wrapped up. This is what our second award program is about. We're going to have 4 awards at $5,000 each, and the awards will be announced January of 2019. This is the Improved Systems Performance team. They have created the toolkits here for easy access. We have an HPV vaccine toolkit. We have a meningococcal toolkit. We have education events, and then we have a Tdap toolkit that is in progress. So we're trying to focus on the wide array of all current the most important adolescent vaccinations. And developing a toolkit, I found out, is not as easy as you might think. It takes a lot of work by a lot of folks. This is just some of the things that the HPV toolkit has in it. It has links to websites, clinician resources, quizzes, and loads of other great resources. I'm not going to play the videos because I don't have enough time today, but I strongly encourage you to get on the website and get to the toolkits. And it's really, really good resources that we can all use. These are some of the things that the toolkit outlines. Key documents. These are our current goals. Those, I think, have been outlined well enough. I do like to, brag, and I'm not going to take any credit, but we have gone from last to not being last, and I don't know. I'm excited that we're not last. We've moved up significantly. We have a lot of work to do, particularly in the realm of HPV, as you can see. But we're on our way, and I'm excited that we're on our way. And it's great not to be the worst state in the union. Again, HPV education event toolkit talks about some of the things that we can do there. Again, we want to raise awareness about HPV vaccine through stories of individuals with HPV-related cancers. This is a little bit about the meningococcal vaccine toolkit. We did have one of the lowest meningococcal vaccination rates. I will say that our rates have improved quite a bit in the last 2 years, and that's good. I'll talk about this if I have time in the advocacy piece. These are some of the documents in the toolkit: provider call to change, community call to change, toolkit user guide, meningococcal quiz, and I didn't point out in the HPV there's also a really cool quiz also that people can take. These are the 2020 goals. Our goal is to increase quadrivalent meningococcal conjugated vaccine rates in Kansas from 13 to 15, from 64 to 80%, which dovetails in with 2020 goals, healthy person's goal. That's an aggressive goal. We'll see how it works out in a couple of years. This is how we're doing with HPV. I don't know if that's that well in focus, but again, we have improved a lot. And I don't know if you can see this, but compared to the United States, we've closed the gap with the rest of the country. And again, that may need a little focus. or it's my glasses need to be filled.
Is that
There
better?
we go.
Is that better?
Yeah, a little bit. So that just gives you an idea of what we've done in 1 year. Again, this is for more information. You can check out our website, or you can visit our Facebook page. I think I got about 2 more minutes. About 4, okay. So, I guess after you practice family medicine so long, you finally decide maybe you should really take it serious and try to make some changes. So I did run for your Kansas legislature, got elected last year. I've been in the House for just 1 session, so I'm over my freshmanitis. I can no longer claim that I'm a freshman. Hillary got to see me flounder as a freshman at the State House. So we had 3 immunization issues we put forth, and I jumped right in with both feet because, you know, I'm like, well, I don't know how long I'm going to be there, so if I'm going to affect change, I better get going. So I did. We had 3 issues we worked on. One was requirement for the meningococcal vaccination. 2 was to have mandatory across the board provider use of WebIZ across the board, no exceptions. And the 3rd was the pharmacy issue that we talked about. And that took some wordsmithing, it took some compromise, and that's what you learn how to do. And what I have is a copy of House Bill 2030, which was actually a combination of 2 of those issues. And I'm going to give this to Dan and ask him to hand it out to you. So very briefly, House Bill 2030 shows the wordsmithing that goes on with a bill such as this. And we had to change the pharmacy issue from 18 down to 6 to 18 to 12 so that our pediatric friends would like it. And they did, on balance. And there was some compromise. I mean, this was the art of compromise, and the pharmacy had to also come around to like it and agree to it. So we compromised on that, and that's why the language is now down to age 12 and older. And that, I thought, worked out pretty well, because that gives, again, another opportunity for our young people, if they're at the pharmacy, to get their vaccinations, to get updated. And since we're all on the same registry, we should all know where they stand in the state of Kansas with WebIZ, which is a very, very good tool. The problem is, and I have to point the finger at myself and my fellow physicians, at least in the state of Kansas, docs didn't have to use WebIZ. They weren't required to. And we had, and you know, I've heard different data, but the data I saw was about as high as 40% of physicians were not using WebIZ a couple of years ago. It's dropped quite a bit, but we still had a lot of physicians that were not using it. Now, pharmacists were required to use it. Public health departments all use it because it's beat in their brains through KDHE that they have to, and they do. And so the only defect we had was with physicians, and so there was inaccurate reporting. Now, as of 2020, I believe it was January 1st or June 1st, I can't remember, I should remember this. July 1st, all physicians and all providers will have to participate in WebIZ. So we should be able to, and this is a great asset and benefit, particularly to disease trending and tracking, because we'll know who's exactly where everybody stands into the future with all their vaccination rates. The meningitis issue was not passed. It was tabled, and we have 1 more year to work on it. I won't go into the details, but I'll say I learned a lot about vaccine avoidance, and I learned a lot from that crowd of why they are so strident about required vaccinations. And that was an education for me as a family doc and as a legislator. And with that, I want you to know that I feel like this type of thing is sort of the end game for advocacy. This gives me special meaning. I feel good about getting this done. These are 2 of my 3 bills for immunizations that we got passed, and so if nothing else, if I don't get anything else done, I can say I got this done, and I'm pretty pumped about getting that done. So I really thank you for your attention and your time, and I know we're going to hear a great conclusion here today, and I'll turn it over to our last speaker.
Thank you very much. And I'd like to thank you for the invitation to be here today, to share my daughter Becky's story. I always, as I go out and do these presentations, I always let people know I don't know nothing about health. No, I shouldn't say that. I'm not a doctor. So when I tell this story, it's from a parent's perspective. And let's see if I can get this done in 20 minutes. Usually I do that in double the time, but let's see how it goes. There she is. Little snot. Typical kid, right? Typical kid. I always, most of the time I do these presentations at a high school. I don't do the middle school because I think it's a little bit tougher for that age group to hear it. But the high school kids, I think, imagine getting 900 high school kids in an auditorium and you can't hear anything. I mean, you could hear a pin drop, you know, they're ready for it and they listen, and it's pretty cool. There's Becky with her dog, Rocky. Again, typical kid, loved animals. Typical grandpa and grandma picture, right? Becky played volleyball. She was all conference setter. That was kind of her sport. She loved country music. She had a Honda Civic that her and boyfriend Rich were always doing something to, whether it was cleaning it or putting a big music system in there. We've all seen that with our kids, right? Becky loved yellow roses. That was her favorite flower. It's funny because I found out boyfriend Rich came over one day, knocked at the door. I come out there and he's holding his yellow rose, and I go, "Hey, Rich, what's going on?" He said, "I don't know, Becky's mad about something." A couple of minutes later, here's Becky walking down with the vase, flower in the vase, you know. 4 or 5 days later, I get the knock at the door. Rich is out there with a flower, you know, yellow rose. I go, "Rich, what's going on?" "I don't know, she's mad again, I don't get it." Well, Rich was a nice guy, but not the sharpest kid in the block, you know. Never figured out that those roses only last about 3 or 4 days. Anyway, I can go on about Rich. It's a fun subject, trust me. They actually were engaged at one point. Becky got buried with the engagement ring, which was that's a whole nother fun thing. But butterflies, you'll see that we spend a lot of time talking about that. That's kind of our little symbol for Beck. Found out she wanted to get a best friend tattoo, you know. They didn't do it, but talking on her cell phone. Now, back in 2003, 2004, texting was just coming out. Kids today, they just text like crazy. Well, we all do too, right? Because we want to communicate with our kids. But Becky, I got a cell phone bill for 3,200 minutes in 1 month. I said, "Becky, what do you do? Take that to bed with you?" "Yeah, sometimes." But you know, the message I try to give is that Becky's just a typical teenager. And if it can hit Becky, it can hit anybody, right? And when I bring that out to kids and I show her a picture and I say, you know, she could be sitting right there and blend right in with you. They do listen. And, well, Becky was my hugger. We started every day with a hug. She kind of spoiled me. That was kind of special. So the meningitis profile that, you know, for years and years, the CDC, you know, if you call them, you know, they would hand out these flyers to universities and tech colleges and community colleges, and on that sheet of paper it would say, if you're going to be a freshman college student living in the dorm, we recommend you get the shot. That was the message forever. In fact, the reporter today said, was she a college student? Well, yeah, she was in college, but she lived at home. She went to a tech college for a marketing degree, was there 4 hours in the morning, worked in my office in the afternoon. When Becky brought that piece of paper home that said college freshman dorm, we threw that piece of paper out. My wife, yeah, it says it here, my wife worked, she's an x-ray tech, worked at a local clinic in town. She went into when we got that piece of paper, went into work one day and says to the doc, hey, I got this piece of paper, you know, about both our daughters are now in college, should we get that vaccine? Doc says, oh, that's so rare, don't worry about it. If there's an outbreak, bring them in and we'll give them a shot. You didn't think we'd be the outbreak, huh? So I'll keep this short. Interestingly enough, I had to go on a business trip to Cancun. They made me go. And I thought it'd be nice to take my wife and girls with, and so we went on this trip to Cancun, and on February 11th was the day we were coming home. We started the morning, I made them get up at 5:30 to watch the sun come up over the ocean, and we took some pictures along the lake shore. This picture tough for me to look, why I can't believe I'm even doing this now. But I can look at that picture for 6 months. This tells me a lot about me and Beck. She wanted to, in February, send pictures home back to Wisconsin where we were suffering with 10 below temperatures and go to her friend Nana in Cancun, you know, that kind of thing. So I ran up and kissed her on the cheek, and of course then she turned around and pinched me on the back of the arm, and I had to slug her in the thigh, and she jumped on my back, and this was 7 o'clock in the morning, right? We look at my wife, and she's over there like, are you kidding me? You're gonna start the day like that already? Becky would come up to me and say, hey Dad, what can we do to drive Mom nuts today? You know, it was just, she was a lot of fun, and you know, she'd say, hey Dad, you wanna go for ice cream? You wanna go for a bike ride? You got $10 for gas? Of course, then she'd take 20. Just a neat kid, and this tells me a lot about us, which is, now it's on my phone. And that's one of those pictures, you set the camera on a rock, hit the timer, run over and you go, did it click yet? You know? This was 2 weeks to the day before Becky died. Ended up being her last family picture. So we got back, and I wrote Becky an email and told her how fun it was to go to Cancun with her, and talked about how nice it was for her to interact with the business people that I had there, and just telling her what a great time it was. She writes an email back and tells me, yeah, Dad, I had lots of fun. Maybe we could do this before Annie and I get married. Valentine's Day was coming up. You'll always be my Valentine's no matter what. Of course, she was fighting with Rich at that point. And then we deleted 3 paragraphs, one about Sean, one about Dean, one about... I swear she put that stuff in there just to drive me crazy. Anyway, she said, hey, thanks, Dad. Maybe we can go out and grab a bite to eat and talk about things. I love you, Daddy. Back. 4 days later, she went with best friend Katie to UW-Madison, University of Wisconsin-Madison, to go visit some friends there that they had gone to high school with. She came home on Sunday. We went for ice cream and talked about a certain cell phone bill that had shown up. Monday was pretty normal. She went to school, came to work in my office in the afternoon. That night we all went out for pizza. February 24th, started out normal. She came and found me, said, good morning, Daddy. I said, good morning, sweetheart. She said, Daddy, I don't feel so good. I said, what's the matter? She said, I don't know, I just feel lousy. And she had the chills and, you know, kind of a weird shape thing going on. I said, hey, Beck, looks like you got the flu. Maybe stay home, grab a blanket, lay on the couch, drink lots of water, take your aspirin. Things we've all been through ourselves. And every time I do this out of high school, I said, how many of you have done this? And everybody's hand was up, you know. She did that. Mom checked up on her. It was pretty much status quo that night, pretty much the same. But about 1 o'clock in the morning, we find her laying out in the hallway between the bedrooms. My wife goes out and said, Beck, what's going on? She said, I was trying to get to the bathroom. Okay, helped her up, got her to the bathroom, water aspirin, back to bed. 3 o'clock, pretty much the same kind of thing. 5 o'clock, she had crawled into our bedroom, bedside. This time I had to get up and help her because she was real heavy, real lethargic. She was complaining about tingling in her legs. Said she couldn't see about 5 o'clock in the morning. In the winter, it's dark. You know, we got in the hallway, her eyes were rolling in the back of her head. We got her in the car, went down to the hospital, got to the ER, answered all the admitting questions, and then the doc started taking her blood pressure, 65/37. In his third shift, doc all of a sudden kind of woke up and talked about, we better do a urine test, we better do a blood test, we better do a spinal tap, and out the door she goes. My wife and I are looking at each other, like, what's she talking about? Becky's got the flu, you know, thought she was dehydrated. And things started happening. A couple hours later, they couldn't do the urine test because her kidneys had shut down. Of course, they assured us that she's 20 years old, she's strong, otherwise good health, athletic, doesn't smoke, you know, all those good things. Then they do a blood test and they come back and explain to us that her blood cells are crowning, shows a blood infection present, started antibiotics. I go outside to make phone calls and tell family and friends to start praying for Becky, and I come back in, they had knocked her out, sedated her, put a tube down her throat, just started hammering the different antibiotics and such to try and catch this thing that was going on. Of course, her body wouldn't keep the blood pressure up. They had to keep giving her meds for that. 2 o'clock, I see doctors, I'm bedside by Becky, and these doctors are going back and forth in ICU, and they're telling us, they're talking about Marshfield Clinic and Mayo Clinic, and talking to doc friends to try and figure out what they got, what they're trying to fight, and what's the best way to attack it. Did it blood transfusion? Again, numbers that I hear, right or wrong. I was told that this bacteria doubles itself every 20 minutes. So as fast as they did a blood transfusion, the blood was getting infected, and of course my wife, being medical, hears it differently than I do, but I can only tell you what I'm hearing. In the end, it was that this bacteria was in her system. They didn't catch it soon enough that they could effectively treat it. By the time they got to her, it was too far along and they couldn't catch it. 5 o'clock is the first time I hear they think she might have meningitis. Of course, she was never stable enough to do a spinal tap, and by the time you get the information back from, we think she might have meningitis. And I remembered that being, hasn't had a spinal meningitis, and that's something, I didn't know a lot about it. I'd heard about it, but I didn't know there was a vaccine for it, right? Interesting. Tough time to hear that. And then in the same sentence, this doc says, if she doesn't respond pretty soon to one of these treatments, we may lose her. I said, whoa, wait a minute. 11 hours ago, she walked in here and you're telling me she might die? She needs to respond to one of these treatments soon. We're like, wow. And I had to go down and relay this to all the family and friends that had gathered. And I remember telling them at that time, we're talking 2004. I said, they think she's got meningitis, and I remember their faces going, yeah, same way I've heard of that. And I said, hey, folks, you ain't praying hard enough. You got to step up a little more, because they think she may not make it. And I can still see their faces, like, what are you telling me? So I go back by Beck, and I spent a large portion of the day in her ear saying, Becky, don't you quit, sweetheart, keep fighting. Whatever this is, you gotta stay strong. And I'm in her ear hour after hour after hour. In the meantime, they're pumping her with medications and fluids, and her face is, getting larger. They put pads over her eyes because it was just a pretty tough thing to sit there. But I'm telling her, Becky, keep going, girl. And somewhere around 8:30 that night, I look out in the ICU, and the lead doc that's got my little girl in his hands is meeting with my wife. I can't hear the conversation. I find out later he's basically saying, Mrs. Werner, we've tried blood transfusions, we've tried antibiotics, we've contacted everybody we know, and one by one her kidneys shut down, her liver shut down, all her organs are collapsing, honestly. And the only thing left right now is her heart. And my wife says, that's gonna stop too. And he said, yes, I'm so sorry. I saw that. I didn't have to hear it. I leaned over to Beck and I said, sweetheart, I'm sorry I didn't know about this meningitis stuff. I'm so sorry I can't help you. And his family and friends gather around. I leaned over and I said, Beck, have a safe journey. Your daddy loves you. At 9 o'clock, Becky's heart stopped. Smile there, sweetheart. I get to tell people she's not here today because I didn't know enough. We didn't know about the vaccine. My wife, can you imagine living with this? She says, I thought it was a live vaccine and I didn't want to give her that because it might not do what it's, you know. I always tell these kids, Becky didn't have somebody come to school one day and say, hey, you got to hear about this, and go home and tell mom, drag them to the website and tell them about Becky's story so that they can find out about this vaccine that you got to get. We didn't have that happen. We didn't know. And you know how many parents out there don't know? That's when I talk to nurses. When you say you don't get thank yous, you're right. People don't know how important you are. And I try to tell these nurses and practitioners that interface with these moms and dads and kids, you don't get to thank you, but boy, what you're doing is, it's huge. I wish we would have had somebody give us that message. We missed it somewhere. So don't stop. Get up, go to work, and keep doing this, right? Oh boy. So I've been going out doing these talks for, first one I did was 3 weeks after she was gone. And it's, my wife and I talked one day and we said, you know, if Becky was here, she'd say, Mom, Dad, you got to do something about this. So we've been doing it. We've been trying to get kids educated, parents educated. Imagine these kids coming up to me after a junior in high school, come up to me after this talk and go, I'm going to go home and ask my mom right now. You know, imagine that they're going to ask for a shot. You talked about Abby Wold in Florida. She's a nut. We know Abby and her mom came up and were our guests for a golf outing that we do every year. They came up as one of our guests one year. And we've known Abby. She got married, I think, 3-4 years ago. She's just a nut. Wonderful person. Some of you may have heard of Amy Purdy. Anybody here heard of Amy Purdy? She lost both her legs below the knee. She took second in the Paralympics in Sochi, in the downhill snowboard. Came home and on Dancing with the Stars, took second place with that. And for those of you that want to make an impact on a mom or a dad, talk to them about, see if they know Amy Purdy. Get a picture somewhere about that and ask them, you know, Amy gets up every day and the first thing she does after she opens her eyes, she puts her legs on. Because mom and dad didn't know about this vaccine she should have had. Can you imagine starting your day like that? Anyway, I'm used to doing hour-long talks and I could probably go for 4 or 5, so I'll back it off a little bit and we'll give time for questions. But what you're seeing up here now, something pretty special. When we talk about how precious life is. My daughter Annie, who was 18 months younger than Becky, gave us Sylvia here just about 2 years ago, and 8 weeks ago she had a little guy called Hudson. You think vaccines are important, life is important? Man, we can't let tragedy come to kids like this, right? So, I'm probably over time. I haven't been watching. So I thank you for bringing me here and let me talk about Beck, and I'm going to be hanging out the rest of the afternoon. I'd be happy to answer any questions. So.